Hello, everybody. Thank you for joining us. We're going to go ahead and get started. I am so thrilled today to have the American Lung Association with us for this webinar. They have recently done some research into all of the state regulations that pertain to indoor air quality in schools. And they are going to be sharing that research with us today. We're going to have some information that we can share with you via email after this webinar. We'll share the slides, we'll share a flyer that they have. And so all of that will be coming to you tomorrow after this webinar is archived. So look forward to that. I want to say again how excited we are to be partnered with the National School Boards Association to bring these monthly webinars to you. For all of you who want to earn points for the Magna Award after this webinar, stay tuned. The very last slide that we'll be sharing with you has a QR code to a very short survey. I'll give you a hint. The answer to the survey is actually in the survey, so it's not tricky. Answer that survey, get a 100% on it, and your certificate of completion will be emailed to you automatically after you finish that. Because this is a Zoom webinar and not a Zoom meeting, I'll ask everybody to put your questions in the Q&A section. We will get to that when we finish up with the presentation. It is my distinct pleasure to introduce Thomas Carr, the Director of Policy for American Lung Association, and Rebecca Padilla, who is a Senior Manager with the American Lung Association. I'm going to share their slides and turn it right over to them. You guys go right ahead.
Thank you so much, Jill. We're thrilled to be here today. As Jill mentioned, my name is Rebecca Padilla. I'm a nationwide senior manager for health promotions with the American Lung Association. And thank you all again for joining us today. Next, please.
You bet.
So I'm excited to be here with my colleague Thomas, our American Lung Association's nationwide policy director, to share highlights from our policy landscape assessment. Poor indoor air quality affects roughly 1 in 6 people in the US, and proven cost-effective solutions can make a big difference. Before we start discussing the role that policy plays in this critical issue, I think it's important that we do a really brief level setting on the impact of indoor air quality in schools. Next, please. So poor indoor air quality has been linked to lower staff productivity, reduced academic performance, impaired focus for students, and more frequent symptoms for students and staff like headaches, cough, and difficulty breathing. It increases absenteeism for students and missed work for staff, and that drives up costs and really disrupts the learning environment. It also contributes to the spread of airborne illnesses and worsens conditions like asthma, COPD, and even long-term heart and lung disease. Indoor pollutants can be up to 5 times higher than outdoor levels. And since children and adults spend upwards of 90% of their time indoors, the impact is really significant. With over 54 million kindergarten through 12th grade students and nearly 6 million adults in US schools every day, improving indoor air quality has the potential to benefit an enormous population. And that's a huge opportunity to improve health and learning outcomes for all. Next slide, please. So as I mentioned, it's a huge opportunity to improve health and learning right away to address indoor air quality. And it's not just a theoretical improvement. It's really proven, cost-effective, and it's all thanks to state measures that we know already works. Strong policies really make strong results possible. They mean healthier kids and staff with fewer infections, fewer asthma flare-ups, and fewer nurse visits. These measures can boost learning with higher attendance and stronger performance. They advance equity by directing support to high-need districts, and they make action doable through technical assistance, compliance oversight, and funding. So with that, I'm going to hand it over to my colleague Thomas to walk us through our assessment of state policies.
Wonderful. Thanks so much, Rebecca. As folks have mentioned, I'm Thomas Carr, Director of Nationwide Policy for the American Lung Association, and a pleasure to meet you all virtually. Over the past 6 months, I've completed an initial assessment of state laws as they relate to indoor air qualities in schools, and we wanted to share our findings with you all. With the exception of tobacco use, these types of laws were largely new to me, so it was interesting getting to know more about them. Next slide, please. So this slide outlines how I conducted the assessment. As you can see, the review covered a variety of indoor air quality topics in schools. I used the Environmental Law Institute's comprehensive database of IAQ laws as a starting point, in addition to an older web page from the Environmental Protection Agency itself. I reviewed and verified all statutes and regulations listed through looking at online versions of individual state laws and regulations. Next slide, please. I don't think the main finding here will be too shocking that there is a wide variation between the states in terms of indoor air quality laws in schools. Virtually all states have laws that in most cases prohibit smoking and tobacco use, in some cases, in the majority of cases, tobacco use in schools, and in many cases on school grounds as well. Note that these data are from the Lung Association State Legislative Action on Tobacco Issues database, which is a little different from the other types of laws. Laws on radon, mold, pesticide use, lead, and laws setting ventilation standards in schools were the next most common. Across the categories we looked at in terms of states, Connecticut, Illinois, North Carolina, and the District of Columbia had the most laws related to schools across all the categories we looked at, although how comprehensive these laws were varied from state to state. There were several states that were close behind, including California, Indiana, New York, and Oregon. Next slide, please. We did more of a deep dive into the 13 states we found that required or encouraged adoption of indoor air quality management plans in schools, which are plans to help with kind of lay out how to manage the indoor air quality. They are outlined on the map on this slide. I'm going to go through the different ways we categorize the laws in the next few slides. Next slide, please. These are the states we found that required adoption of indoor air quality management plans or required annual investigations of indoor air quality in schools, along with a brief description of the laws for each of them. We can go into more detail about the individual laws during Q&A if we have time. Next slide. These are the states we found that encourage adoption of indoor air quality management plans in some fashion, along with brief descriptions of what they do. Several of these laws involve encouraging use of the Environmental Protection Agency's Tools for Schools program, which addresses indoor air quality schools in a comprehensive manner. Next slide, please. So Delaware in 2024 and Virginia just this year in 2025 passed laws that require indoor air quality monitoring in schools. Note that the Virginia law just took effect on July 1, and Delaware is still at the beginning of its implementation phase, so that is why we put them on a separate slide. So with that, it's important to remember that a passage of state laws is only the first step, and how a law is implemented can make a big difference in how impactful it is. I'll now turn it over to Rebecca Padilla to talk about some outreach we did to the states with state laws on indoor air quality management plans in schools to better understand how the laws are being implemented. Rebecca?
Thanks so much, Thomas. So between January and April of this year, we spoke to a sample of states to understand what's working, where gaps remain, and how we can strengthen and support their work. Our conversations with this small sample of states revealed some important patterns in how states approach indoor air quality in educational settings, from what's working well and where we have those big opportunities to really bolster their policy. So like the slide on your screen right now says, what you count counts. So across our conversations, we saw that strong measurement, clear accountability, and intentional prioritization make a real difference in how IAQ is managed in schools. Next slide, please. So looking at the map, you can see where we conducted interviews, connected via email or still waiting responses. From these discussions, we really started to identify some clear patterns. Next slide, please. So our first key pattern that we saw across different states is the dramatic spread in accountability mechanisms. So at one end of the spectrum, in some states, there's a requirement for schools to post their IAQ plans publicly, and it really ties compliance to health-related funding and actively monitors their progress. Unsurprisingly, those systems show the most consistent building-level implementation. To contrast that, on the other end of that spectrum, we find places, states where plans are required but never collected, statutes exist without any verification, or the guidance itself hasn't really been updated in upwards of 2 decades. Implementation in those states is uneven at best. So the takeaway is simple. Measurement and verification are not nice to haves. They're really the engine of policy success. If we want every student and staff member at schools to breathe clean air, we really need to embed clear reporting, incentives for that reporting, and monitoring into those state-level frameworks. So states with strong accountability mechanisms for school environmental health programs, such as public posting requirements, funding ties, and active monitoring, demonstrate significantly better implementation compared to those other states with minimal oversight. And this really helps to illustrate that that measurement is essential for effective public health policy and executing that policy, demonstrating again that what gets measured gets managed. Next slide, please. So our second finding shows states with robust technical support infrastructure, things like annual trainings, implementation assistance, and targeted resources, really achieve significantly better school environmental health program outcomes compared to states that rely on more outdated guidance or limited resources, demonstrating that ongoing and accessible technical assistance is essential for successful implementation. Next slide. So we also started to see some common implementation barriers. So despite varying policy approaches, states really face consistent implementation barriers in school environmental health programs. And that includes, of course, funding constraints, climate challenges without proper guidance in place on how to address those challenges, limited maintenance capacity, competing budget priorities, insufficient buy-in from facilities staff, and widespread technical expertise gaps. Next slide, please. So key motivators for successful indoor air quality management in schools includes improving student health, increasing transparency for parents and caregivers, providing funding incentives, fostering interagency collaboration, and responding to emerging crises like climate change, COVID-19, and wildfire smoke. Next slide, please. So with this, I'm going to hand it back to Thomas to explain a little bit more about some recommendations that can help us dive deeper into our findings. Thomas?
Thanks, Rebecca. So over the past several months, what we've done is taken what we've learned from the state laws assessment and come up with 10 action recommendations related to indoor air quality in schools. I will say these are still being fine-tuned, so there could be changes or additions that occur. We're also planning to create a short report that outlines our findings from the assessment into more detail, and we'll include these recommendations over the next several months. Next slide, please. So with that, let's dive into the recommendations. The first recommendation is that each individual school should have an indoor air quality management plan that maximizes energy efficiency and details how the school should assess and manage indoor air quality issues. The plan should require the school to conduct an annual indoor air quality assessment. The currently recommended plan is based on the Environmental Protection Agency's Indoor Air Quality Tools for Schools program. States may also have or want to consider creating model plans for schools, as that could increase uptake. Next slide, please. Second recommendation is schools should use the American Society of Heating, Refrigeration, and Air Conditioning Engineers Standard 62.1 to set appropriate ventilation standards for indoor air quality and use minimum efficiency reporting values or MERV 13 or higher air filters or the highest level of filter the current ventilation system in the school will support. Regular inspections of ventilation systems should be conducted. And states could consider using existing school facility upgrade programs or implement grant programs to upgrade school ventilation systems. Next slide, please. The third recommendation is all schools should be tested for radon every 5 years. If radon is confirmed to be present at or above the EPA action level of 4 picocuries per liter, mitigation should be performed to reduce levels to below the action level. Reducing levels that are between 2 and 4 picocuries per liter should also be considered. Newly constructed schools and schools in which major renovations have been made should be tested and mitigated as necessary once the building is complete and operational, but prior to regular occupancy. Next slide, please. The fourth recommendation is part of day-to-day maintenance and periodic school indoor air quality inspections. Schools check for occurrences of high humidity, moisture, standing water, and mold, and should immediately identify the source and mitigate it if found. Water intrusion issues, for example, from leaking plumbing, groundwater, faulty roofs that may cause mold, should be dealt with promptly to prevent instances of mold growth to the maximum extent possible. Next slide, please. The fifth recommendation is schools should use safer and/or green cleaning products in regular cleaning and maintenance of schools. Schools should also use integrated pest management systems to limit the use of harsh chemicals and pesticides, which can be damaging to indoor air quality and lung health. Schools should provide notice to all affected parties when pesticide treatments are applied and apply treatments when students are not present to the maximum extent possible. Next slide, please. The sixth recommendation is schools should implement policies that prohibit the use of tobacco products, including e-cigarettes, by students, staff, and visitors in school buildings, on school property, and at school-sponsored events. Punishment for violations by students should avoid harsh penalties, such as significant fines or out-of-school suspensions to the maximum extent possible. Schools should consider using alternative suspension programs for students who use tobacco products, such as the American Lung Association's in-depth program. Next slide, please. Seventh recommendation is schools should prohibit idling of gasoline and diesel-powered school buses, delivery vehicles, and other vehicles on school grounds. Idling should be prohibited on school grounds to avoid exposure in locations where people congregate, for example, during drop-off and pickup of kids or outdoor school activities, and to ensure that exhaust fumes do not enter the building. Next slide. The eighth recommendation is schools should be encouraged to use building materials and furnishings that have less impact on indoor air quality. Building materials and furniture can be significant sources of indoor air pollutants, emitting substances throughout their lifespan. Schools may consider seeking out third-party certification, such as CRI's Green Label or the EPA's Safer Choice Program, to select products with low volatile organic compounds and free of formaldehyde. Next slide. We also have two additional recommendations concerning schools implementing staff education and communication plans related to indoor air quality and establishing protocols for safeguarding the health and safety of students and staff during indoor air quality related school emergencies that I can go into more detail about during Q&A if desired. I'll now turn it back over to Rebecca to talk about potential ways to operationalize these recommendations and resources for schools to help.
Thank you, Thomas. Yeah, so we have several operational enablers here where we can really help implement those high impact actions that Thomas just outlined. Everything from developing standardized metrics and thresholds to providing TA is critical. Improving school indoor air quality takes more than just good intentions. It really requires a coordinated approach that combines those clear metrics, targeted technical assistance, peer-to-peer learning, climate resilience strategies, and really practical tools that schools can use to put their plans into action. These operational enablers create the foundation for change, but schools also need a clear pathway for getting started and for advancing their efforts. And that's where I would love to take just a moment to talk to you all about Lung Association's Clean Air School Challenge and where it might come into play here. Next slide, please. Thank you. So the Clean Air School Challenge really strives to meet schools where they are in their energy efficient IAQ management journey. Participating schools receive support and guidance as they work their way through the 3 program phases from assessment, planning, and action. And benefits of participation include recognition, training, and a technical assistance program, a structured path and support for development and adoption of EE/IAQ management plans. We'll also be offering peer mentorship, so state school districts can get matched with other school districts either in their state or perhaps across the country, where they might be able to learn some really valuable lessons from the field. We'll also have resources and programs to engage school staff, parents, and the community. And best of all, we have the option to apply for mini grants to help support those actions at each step. Next slide, please. We also have amazing partners to help support schools along the way as well. So we have access to a great network, and the schools that we'll be supporting will have access to that network as well. So we'll be sharing a flyer after today's webinar if you want to learn more about Lung Association's Clean Air School Challenge. You can also visit our website. It's up on the screen right now, or you can email our team or Thomas and I directly. So I know we just covered a ton of information, and we tried to do it in a brief amount of time so that we could address any questions that might have arose or address your comments. So, we've seen how strong measurement, accountability, and clear motivators can turn policy into real improvements in indoor air quality, from protecting student health, building trust with those students and their families, and preparing schools for future challenges. So with that, I'll turn it back over to Jill. Do we have questions or comments we can address?
You bet. Before we do that, just really quickly, before I stop sharing the slides, I want to give everybody the QR code for a survey, very brief survey, 1 question only, that you can take, and you can earn points for your school district toward the NSBA Magna Awards program. And so if you would like to earn points for the Magna Award, please scan that QR code now. You can take that survey, and your certificate of completion will be sent to you via email automatically. And I'm going to look at our Q&A. Right now, we do not have any questions, but folks, now is the time to ask the American Lung Association anything. All right, I see a question. This is what it says. Are there elements related to fragrance and chemical sensitivity that are taken into account or included in the air quality conditions? I did hear the encouragement for using safer cleaning materials, which would help with the chemical sensitivity aspect. Any thoughts on that, Thomas and Rebecca?
think it's definitely
I
a point. I, th- I think it's definitely a point worth considering. I know the Lung Association certainly believes that at least fragrance-free or reduced fragrance policies can be very beneficial for indoor air quality. So, but Rebecca, if you have anything to add, definitely. So,
Yeah, thanks, Thomas. A lot of times in IAQ frameworks and school health guidelines, fragrance and chemical sensitivities are often addressed, but they're addressed under a broader umbrella of a category like VOCs. Those are volatile organic compounds, and those are the smell good and often cause allergy chemicals that are in fragrances. So those fragrances might be under the VOC policy. It might be addressed under hazardous chemicals or under indoor environmental triggers in a school's framework. So, of course, a lot of times we recommend going fragrance free if possible. And then using those EPA Safer Choice certified products or those green seal products can be really beneficial because they have fewer sensitizing agents. They're not 100% free of them, but they have fewer sensitizing agents. And a lot of times that can really address respiratory and chemical sensitivities.
Well said. And so that's going to be something that whether you look on the American Lung Association's website, Go Green Initiative's website, NSBA's website, when they go into the Magna Awards, we have resources for helping schools and school districts create energy efficient indoor air quality management plans. And in fact, on the Go Green Initiative website, gogreeninitiative.org, we have an online course. It's a free online course for creating an indoor air quality management plan. And that is part of the section that Rebecca mentioned. We give you a template, we walk you through customizing that template for your school district. And that is part of the VOC or volatile organic compounds section. So be sure to check that out. Thanks for the question. We have another one. It's from an anonymous attendee that says, has anyone tried to examine actual outcomes from monitoring programs or inspection programs in terms of absences and learning outcomes? Do we have enough school level data to conduct such a study?
So I think there's been some attempts that have been made to link indoor air quality monitoring or inspection programs to things like student absences or academic performance. But the evidence on that is still, um, there's still some gaps in the evidence. And that is primarily because it's really difficult to get consistent school level data and to get that across multiple systems, right? And a lot of this, when we do have folks reporting on outcomes, it really kind of depends on who's doing the reporting, what's getting measured. So there's so many variables at play that it's really kind of fragmented in view right now. But we hope with programs like ours and all of the great tools that Lung and Go Green has, that we can encourage folks to get a more robust framework in place so that they can do better measurements, do better reporting, so that we can make those clear and direct linkages.
I love that. Thank you, Rebecca. And I want to add just one quick thing. As we should have mentioned at the beginning of this webinar, both the American Lung Association and the Go Green Initiative received the same grant under an EPA program. And we are both working with schools and school districts on this. One of the things that the Go Green Initiative will be doing in our program, we are working with cohorts each year of school districts, one school district in each of the 10 EPA regions. And just this past May, we had the first application close for cohort one, and we have 10 school districts in 10 different states, and we'll be walking them through a process of implementing an indoor air quality management plan. And then they can earn funding from our grant program for reporting exactly what you're talking about. And so while we have some research out there that talks about how indoor air quality can bring absenteeism down, the research on student performance is there, but as Rebecca said, it's not as consistent. And that's because it takes time, more than one school year to conduct those kinds of studies. And that's where more funding for research into those types of parameters and key performance indices would be very helpful. But we're going to try and give it a whirl. This grant that both of our organizations received is 5 years long. And so over those 5 years, we are going to be taking some of those key performance indicators. So hopefully we'll have some data for you before long. But as somebody put in the chat, Boston Public Schools has been doing this since the pandemic. They don't have metrics on student achievement at this point, but they do have some metrics on absenteeism. And we just had them on for our last month's monthly webinar. And if you want to check that out, you can go to Go Green Initiative's YouTube page. We have a whole playlist on indoor air quality for schools, and you'll see that the July webinar was Boston Public Schools and their partner, Boston University. So they talked about that. So thank you for that question. That was great. We have another comment in the questions. In addition to EPA's safer choice chemicals for green cleaning, this first person put in that you can also see Green Guard, which is a nonprofit organization, a third-party certification program for other chemicals that are lower in VOCs as well. Thank you for that. I appreciate it. Yes, Thomas, go right ahead.
So in the actual recommendation, we do mention Green Guard and also Cradle to Cradle as well too. I just shorthanded it a little bit, so we know about them too.
Awesome. Thank you so much, Thomas. Yes, Green Guard has been around for quite some time, and so both programs will give you safer chemicals. We have an anonymous attendee that asked if the American Lung Association folks could share more about the mini grants that you have, who qualifies and how. And then I'm going to share something from one of your associates that they put in here. I'm going to put it in the chat so everybody can see it. It's a page that everybody can check out. Let me do that real quick. But if Rebecca and Thomas want to cover that, go right ahead.
Sure. Excuse my voice. Yeah, so as I mentioned during our presentation, we are offering mini grants to schools across the nation, and we're offering them to kind of any and all levels of their work on EE/IAQ management. Whether they are assessing in that stage, they can apply for a mini grant for their assess phase. If they're in planning, or if they're, at that third level of action and implementation, they can apply for a mini grant for that as well. So we've really done our best to try to streamline things and make it as easy as possible. We know that schools are really overrun on their capacity right now, so we really try to streamline it and make it clear and easy to apply for these. So our mini grants are going to be awarded to approximately 800 schools nationwide, and we're awarding those between now and December of 2028 on a rolling basis. So, schools can apply when the time is right for them. We encourage you to go to lung.org/CASC, CASC. That's the Clean Air School Challenge. And you can learn more there. Our team would be happy to meet with you and see how applying for a mini grant would work for your school district or school. But we really have some great opportunities here. So, for instance, if a school was at that foundational level of assess, an assess mini grant would support that school to conduct indoor air quality and energy management assessments. And examples of those assessments might, or the costs associated with them, might include things like doing a building walkthrough assessment or, you know, spending, some of that funding to determine clean air exchange rates, conducting staff assessments of indoor air quality issues, kind of doing some interviewing with the staff to see what their concerns are. It could also be used for testing for radon, asbestos, or even mold. So there's some really great ways that these can be tailored to each individual school environment. And schools can either use their state's required model indoor air quality management plan, or they can work with us to really draft a plan that's going to use that model language and really incorporate the best of the best guidelines possible that the EPA has outlined in their tools for schools. Yeah. So
Thank you
what we're,
so much.
yeah.
Yeah, go right ahead.
Oh, I was just gonna say, and we have so much information on our cask lung.org/cask. So many information and videos, resources available. So please take a look at that, and we'd be happy to help support you.
And while you were speaking, Rebecca, one of your colleagues gave us some great information that I just shared in the chat that everyone can see. That's also in the Q&A section. Everyone can see that. Some great resources from the American Lung Association. So thank you for that. We have another question for you all. The question is there an effort underway, either by the American Lung Association or others, to assess what is working well in the states that have requirements? And what was the genesis for these statewide requirements? For example, were they initiated by an advocacy group, a parent, an interested state legislator? I'm wondering what lessons for replicability may exist to get more states thinking about policy shifts to support IAQ management in schools.
I think so it's I do not have the historical knowledge about how some of these laws came about. So I can't speak too much to that. It does seem like a lot of this was done piecemeal. So there was like one requirement passed at one time. And so maybe one thing in terms of replicability is trying to package some of these reforms into a bigger package of sorts and like trying to, as part of an indoor air quality management plan, have some of these other issues be part of that as well too. I think is a promising idea. So, but
Yeah, it's true, Thomas, because when we talked about this before, one of the things that we saw was that sometimes you won't see a bill labeled indoor air quality in schools. You'll see it, having to do with tobacco or anti-idling or chemical use. And sometimes people aren't thinking indoor air quality. They're thinking about just that singular siloed issue. Whereas, if states that are maybe lagging a little bit behind in policy, just as you said, had a comprehensive policy that incorporated everything from radon to anti-idling, and named it indoor air quality. Something about that. That would be more clear to a lot of folks because there are even lawyers who work for state school board associations that thought my state doesn't have anything to do, in terms of legislation regarding indoor air quality. But in fact, they did. It just wasn't called that. So I think that's one big plus that states could take on board. Great recommendation. Anything else that you're thinking, Thomas?
I mean, I know Rebecca talked about some of the implementation kind of examinations we did, which I thought was really interesting too. And that so that I think there's some good things that came out of that as well. And I don't you can add to that if you want to, but that was the other thing. So
Yeah, I think some of the states where we see some really robust implementation frameworks developed, that comes directly from a really engaged, collaborative, cooperative, multi-stakeholder coalition groups. I can think of several states that have really engaged coalitions that are directly working either on IAQ issues directly or again under that broader umbrella of school health, right? So when you get those multi-stakeholder collaborations going, and we're talking from student advocates to engaged family members and caregivers to student nurse association or school nurse associations to the public health department, to lawyers that may be working on these issues, and bring everyone to the table. You really start to see some comprehensive policies getting implemented. So it's great to see that multi-level collaboration happening at the state level.
And I will add as well that the states that are actually requiring some sort of check, some sort of inspection, are seeing more results than states that mandate something and then never check up on anyone. I'm a former naval officer, and my commanding officer used to tell me, you don't get what you expect, you get what you inspect. And that is so true. If you are in a state that is new to this, or maybe hasn't touched these policies for a while, and you're looking to advocate for updated policy, be sure to advocate for some sort of enforcement, some sort of inspection, some kind of requirement that requires the schools to show their work. We ask the kids to do it in every math worksheet I ever have seen. Show your work. And that's what we need to be doing with indoor air quality management as well, so that we can ensure that all of our state school districts are staying up to speed. And if they're not, finding out, what do you need? You're a little behind here, school district XYZ. What do you need? And that way the state can ensure that if there is some technical assistance, some financial, assistance that's needed, the state knows who needs some extra support and scaffolding.
They know, and they can really make that argument for that sustained or enhanced funding, right? So I love that you don't get what you expect, you get what you inspect. I'm adding that to my what you count counts.
There you go. There you go. A little Navy wisdom for the day.
I love it.
Are there other questions? I want to make sure that while we have these two amazing folks from the American Lung Association, that if you have any questions, you put that in the Q&A, and we have an opportunity to get their insights. I will say as well that everybody who registered for this webinar will be receiving an email tomorrow with the recorded webinar up on our YouTube page, a link to the slides, a link to their flyer, and if I have their permission, a link to a spreadsheet that shows all the states and the regulations that they have, so that if you're in an advocacy role, and you're in a position to advocate in your state for updated policy, you can see what exists, how fresh it is, and maybe where there's some room for improvement. And you'll be getting that tomorrow. Any other questions? All right, seeing none, give me one quick second. I'm going to give you that QR code again, folks, where you can earn points towards the NSBA Magna Awards. This is the QR code to take that quick survey and earn your points. We're going to be here same time, same place next month. We're trying to do the second Tuesday of every month with our monthly webinars. Next month's webinar is going to be on the Magna Awards. We've had a big change in the Magna Awards. It used to be sort of a open-ended narrative, and now it's a points-based system. And I want to make sure that every school district in America has the opportunity to take a look at earning these points. It's not hard. It just takes some know-how. And so we're going to walk through that step by step. Second Tuesday of September, same time. I'll also send you a link to register for that in the email that you'll be receiving tomorrow. Well, I'm going to give us all some time back. Thank you, Rebecca. Thank you, Thomas. And thank you to the American Lung Association for partnering with us and giving us this amazing information. Thank you for all the work that you did that went into the research behind all of the state policies. This is unparalleled and peerless information, and we could have only gotten it from the American Lung Association. So thank you all so much for being with us.
Thanks, Jill.